Hey, Jim.
Hey, Doc. Thank you, by the way.
So,
Appreciate it.
my pleasure. So, about a month ago, we did an injection on you in the disc we thought was causing the problem. Now, you've had pain a long time, correct?
About 21, 22 years.
Mm-hmm. And can you just describe what that pain was like and what activities made it worse before you had it done?
The pain was mostly on the right side, and I believe it was around the L5.
L45, right?
Yeah, and right in that area, mostly on the right side, and a little bit of like tingling into my legs. It would come and go, but the pain would keep me up most of the night, and I couldn't get any real sleep, and it would just come and go. And the procedures that we did initially, when I first started coming to you about, 7 years ago, would take, it was like putting a Band-Aid on a severed artery.
So it was probably epidurals.
Yeah, epidurals and
maybe radio frequency.
Radio frequency.
Right.
We've tried everything.
That had limited effect.
It had limited effect, and then what happened was the last time you did it with the steroids and whatever we did had zero effect.
Right. So we knew we had to change.
Yeah.
So we looked at your MRI, and you had a degenerating disc, specifically at that L45 level, and it was bulging the right side. And I said, I think this is probably the source. That disc. I assume you had pain with sitting and driving too, which is pretty typical disc pain.
The way the pain worked would be, if I stayed in one position for too long, then the pain would kick in. So I'd have to be constantly moving. When I was driving my truck, it's the same thing. But the chair I had was like a captain's chair, and it was the most comfortable chair. But irregardless, I still had to keep repositioning myself to stay out of pain.
Okay.
Yeah.
So we did this about a month ago, and then it was pretty quick response.
The next day, no pain.
You felt a lot better, and then it's kind of gotten better, and you've resumed a lot of your activities. That you're even jogging.
Yeah.
Again, I mean that's pretty amazing, and it's been a month or so.
I've lost almost 15 pounds in the past 2 weeks or so since it's a little over 2 weeks ago we had the procedure, and because of the steroids before, it caused me to gain weight where I was down to 180. Now I'm down to about 190 where I was
so
up to 205.
it's nice times, right?
Yeah.
Right. So now it's sort of giving you a new lease on life, and it's really going to hopefully change things for your lower back. And what are your plans for the future now that you're feeling so much better?
Well, I'm 65 years old, and now I'm painting, and I just right now
bend and
I can do
lift
everything. I can actually do a cartwheel right now if you want. I mean, I'm telling you right now, I'm just really thankful, Doctor. Thank you.
We've been searching for a solution. Well, this only came out 6 months ago, so
really?
So you're one of the early patients treated, but you've had a remarkable course. So it was wonderful.
Throughout the last couple of weeks or so, I had immediate relief the next day. I was surprised at it, but then a few days in, I had the worst pains in my life. I think it was making an adjustment in me.
And it can flare up for the first week or two, but then it starts to alleviate.
It went up, and then it just came down, and now
that's typical. It's very typical.
Now I don't have, for the first time ever in 22 years or 21 years, I don't have to keep readjusting myself. The pain, every once in a while, I'll get a little twinge on my right side, but I still think that's going to improve.
Okay, yeah, I'm very hopeful. Yeah, actually it improves over the first 3 to 6 months, so that's wonderful. Well, listen, I'm so glad you had confidence in me to allow me to go and do it, and I'm glad you've had a fantastic response.
Makes me want to cry almost. It really does. It's so
My
amazing.
pleasure.
You guys listen to this guy. He knows what he's talking about. He's a blessed man by God right there to take care of you. I hope you don't mind me saying that, but
I'm rather humble about it.
he is really amazing.
Okay, thank you.